Right. In the last chapter for Unit 5, we're going to talk about sterilization, disinfection, and antibiotic therapy. So, as a whole, this is ways to control microbial growth. We will talk about both chemical means, so things like antibiotics, and physical means like this autoclave here. In this chapter, we're going to talk about how some of our chemical agents and physical agents work, so their modes of action, we would call this, what the microbial spectrum they work on is. Or do they only work on bacteria? Will they work on viruses? So on and so forth. The clinical use of disinfectants and other antimicrobial agents, particularly ones used to treat infections. So remember, there's kind of two aspects here. We have cleaning surfaces, and then we have treating people who have infections. Those are two slightly different topics that we will discuss. We'll talk about antibiotics and how they're given and kind of how they're metabolized by the body, things like this. And then talk about this concept of empirical therapy, targeted drug therapy, and synergism in treating infections. Those are all topics we'll talk about. And explain selective toxicity and go into a little bit of detail about the mechanisms of at least one antibiotic particularly, and then talk about how that can influence our development of new antibiotics. Let's start with a case study. So we have Bill. He's new. He's a nurse practitioner, and he's part of this hospital team that's caring for a 9-year-old who is seriously ill from MRSA, methicillin-resistant Staphylococcus aureus. He's changing her bandage and checking on her when he remembers that he needed to ask someone a question. So he goes out to talk about when rounds are going to begin. He leaves the patient's room and goes to the nurse's desk and starts to have a conversation. And he's sitting there waiting for the answer to come, and he's tapping his finger, thinking whatever, not really focusing on what he's doing. And then once he gets his answer, he goes back to the patient's room. We have another physician assistant that stops by that desk that he was just at and starts to read somebody's chart of a 15-year-old Penny who's recovering from an appendectomy. So she goes and visits Penny, and she was recovering just fine, Penny was, but 1 week later, she has died from a MRSA infection. So I think you can see what's happening here. MRSA can cause serious infections, and it is not easily treated because it's already resistant to antibiotics, and it is very easily transmitted in a healthcare setting, particularly hospitals. So there would certainly be an investigation into what happened. It's pretty clear that it transferred from the patient. Bill took it with him while he was tapping his finger or whatever. He probably touched something. Then somebody else touched that and transferred it to a new patient. This is not malicious, right? It's not like they're trying to cause harm, but they forgot basic practices. Things like if you go into a MRSA patient's room, you need to wash your hands before you leave, put on sterile gloves, and a gown would be great, and then take those off before you leave the room. So this practice, obviously, it's inconvenient, but the inconvenience is necessitated by the need to prevent the spread of these resistant strains of bacteria that can be life-threatening to even, somebody that has something minor like an appendectomy. Unfortunately, this is not the only case we will see of healthcare workers transmitting infectious agents from one patient to another. It happens far too frequently. So having that understanding of microbiology in the back of your mind is very important to remember that microbes are out there, they can be transmitted, and it might be something minor like a lapse in memory on how to do these things. So that's where the concepts of sterilization and disinfection come in. We have the whole how do you clean yourself, but then we have how do we clean objects as well. So we'll talk about sterilization, disinfection, antisepsis, which is on tissues, and then sanitation. We'll talk about the differences between bacteriostatic agents and bactericidal agents. And I just want to show you this kind of measure of how effective cleaning is. We have different levels of clean. We don't always need the highest level of cleaning, which is sterilization. So sterilization is the destruction of all living cells, all viable cells, spores, and viruses from an object or a surface. That is difficult to achieve. We will talk about some ways that you can do it in this chapter, but it is not always feasible. We also have kind of the related terms disinfection and antisepsis. This is focused on removing all disease-causing microorganisms from, in the case of disinfection, inanimate surfaces. That doesn't necessarily mean the surface is sterilized, but we're trying to remove disease-causing microorganisms. And antisepsis is removal of disease-causing microorganisms from living tissue, such as like skin or mucous membranes. So before you go to make a cut on a patient, right, we try to do antisepsis to prevent microbes from being brought into that. Again, this is not necessarily sterilization. It is removing those microbes. Sanitation or decontamination is our lowest level. This is reducing microbe numbers to safe levels. Safe numbers, that's a whole other topic, right? What is a safe level? There are different levels for different microbes in different scenarios. We will talk about specific numbers when we talk about something like pasteurization, which is reducing microbe numbers in foods, usually drinks like milk or apple juice or things like that. They're not removing all the microbes. They're reducing it to a number that the average individual can handle. Again, this is called for in some cases. Sterilization is called for in other cases. It depends on what the object is, where the place is, right? Your home, you do not need your home to be sterile unless you are severely immune compromised, right? You have an immune system that can deal with microbes. It's not necessarily bad to sanitize/decontaminate your home, things like your dishes that you eat with and things like that. It's great to clean them. But we'll get to that in a moment. All of these processes, though, improvements in them have, in general, increased life expectancy for humans. So as we have focused on these topics, our life expectancy has gone up because we understand the principles of microbiology, particularly in city settings. Things like sanitation and decontamination are very, very critical to maintaining public health. Places like water supplies, how we treat sewage, how we remove waste and things like that. These are all important things for high-density populations. We're going to talk about some terminology here, particularly focused on the actions of our antimicrobial substances. We have two classes of chemical agents here. We have cidal agents. Those have lethal effects. They will kill, prevent from reproducing whatever they're functioning on. Bactericidal things will kill bacteria. We have different terms for different things. So like fungicides will kill fungi, virucides work on viruses, etc. Cidal agents, again, you might think you always want to kill microbes, but that is not always the case. Particularly when we talk about antibiotics, there is another group called static agents that slow or stop metabolism or reproduction, but they don't necessarily kill the microbe that's there. These can be useful because they can often be less harsh than these. And this generally functions on the principle that the average individual has an immune system which is able to deal with a small number of microbes. So if we slow growth down, the immune system can deal with the remainder. There are, of course, many factors that influence the speed that the killing actions of things like bactericides can work at. One of the main factors is the initial population size of microbe that's in there. The more cells that are in the population, the longer it takes for a cidal agent to kill them all. The types of cells that are in there are, of course, very important. If you have spores in there, many cidal agents will take much longer to destroy those spores, if they can at all. Some things cannot destroy spores. How long they're exposed to the lethal agent and the concentration of the agent. So how concentrated is the chemical that's being used to clean, and how long is it left on a surface? And then this concept of organic load, the presence of other organic material in mixed among the microbes that are in there. So things like blood, feces, vomit can all inhibit antimicrobial action. So that needs to be removed before the antimicrobial can work. So keeping that in mind, these are some of the factors that influence how well cleaners work. And of course, there are ways to measure this. One measure is called D-value. It's kind of like a half-life. It's the time that's required to kill 90% of cells. That's really the key that I want you to remember here. And this is used to monitor new cleaning agents and to test them, because obviously if someone comes up with a new cleaning agent, we have to make sure that it actually works before it can be marketed. This graph is a log scale, so these are factors of 10. So this is 10, 100, 1,000, 10,000, so on and so forth. The D value is the time that it takes for 90% of the microbes to be killed, and that can be calculated. We're not going to really talk about any of the details on this for specific things, but I just want you to know that there are measures for this. Okay, so that's our introduction. We'll talk about some specifics in the coming sections. Please remember that sterilization kills all viable organisms, including spores. That is a definition I would love you to know. We have disinfection, that's on inanimate objects. Antisepsis is removing them from the surface of living tissue, and sanitation / decontamination reduces to a safe level. We have static antimicrobial compounds that basically slows or stops growth, and cidal agents actually kill or affect viability. And then that D value is a measure of how long it takes to kill 90% of the organisms. Right, that's it for 13.1.